Welcome to Road Trip Medicare. Medicare began in the summer of 1965, when today's beneficiaries were cruising America's highways, searching for a bright future. The average cost for a new home was just $13,000, and Dylan made news when he dared to go electric. And just about the time TV became known as the boob tube. President Johnson enrolled Harry Truman as the first Medicare beneficiary.
No longer will older Americans be denied the healing miracle of modern medicine.
It was big news, but many of us didn't know how important it was. It was July 30th, 1965, and the federal health insurance known as Medicare was born. For the first time, health insurance was guaranteed for every senior, regardless of health status. By the summer of 1966, our lives were changing, and so were the lives of more than 19 million Americans now enrolled in Medicare. Everyone was celebrating. Not everyone knew exactly how it worked. Well, thank goodness for the boob tube. Part A is hospital insurance that helps pay the cost for inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. Part B helps pay for things like doctor's bills, x-rays, and lab tests. You pay a premium, a deductible, co-pays, or co-insurance. Part B is optional, and there are penalties for not enrolling, but if you or your spouse are working, you may not need it. In 1972, Medicare eligibility was extended to those under age 65 with long-term disabilities and those with end-stage renal disease. With the signing of the 1997 Balanced Budget Act, Medicare beneficiaries could choose between original Medicare and receiving Medicare benefits through private health insurance plans. By 2003, more than 41 million people were enrolled in Medicare Parts A and B, and 5 million were participating in a Medicare Advantage plan known as Part C. But with no prescription coverage and spending for prescription drugs skyrocketing, the Medicare Prescription Drug Improvement and Modernization Act of 2003 was passed. Beneficiaries could now get prescription drug coverage known as Part D. And today, Medicare beneficiaries who have trouble paying for their prescription drug costs may be eligible to get help from Medicare through a low-income subsidy program known as LIS, or simply Extra Help. It wasn't long before everyone wanted more information about Part D and other Medicare benefits, so they turned to www.medicare.gov. Now it's time for you to make a decision about Medicare. You qualify for Medicare if you're a U.S. citizen or permanent resident age 65 or older, and if you or your spouse work for at least 10 years in Medicare-covered employment. Those under age 65 may also qualify for Medicare coverage if they have a disability or end-stage renal disease. You can enroll in Medicare during the initial enrollment period, 3 months prior to your 65th birthday through 3 months after you turn 65. If you're already enrolled in Medicare, you can only make changes in coverage during the annual enrollment period. Uh-oh, maybe she needs a refresher. Part A is hospital insurance that helps cover inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. Part B helps cover medically necessary services like doctor's visits, outpatient care, home health services, and some preventive care. You pay a monthly Part B premium. If you don't sign up for Part B when you are first eligible, you may have to pay a late enrollment penalty. When you're eligible, you can choose from Original Medicare or a Medicare Advantage prescription drug plan offered by a private insurance company and approved by Medicare. Sometimes these plans are called Part C. A Medicare Advantage prescription drug plan must provide everything covered by Original Medicare. When you're a member of an MAPD plan, you have hospital insurance, Part A, and Part B medical coverage. Most members of Medicare Advantage prescription drug plans have to use doctors and providers within the plan's network. And all plans include prescription drug coverage, Part D. Medicare pays a fixed amount for your care each month to companies offering Medicare Advantage plans. And those companies must follow the rules set by Medicare. Medicare Advantage plans may have lower copays. Some plans charge premiums and others don't. Many offer extra benefits beyond Original Medicare. Betty, there are 4 different types of Medicare Advantage plans. It pays to know your options when it comes to Original Medicare and Medicare Advantage plans. That's all we have time for now. We hope you've enjoyed this road trip through Medicare.